The Dental Download podcast is your source for insight into dental school, conversations with dentists, specialists, and leaders in the industry. With new episodes every Monday morning, I'm your host, Haley Schultz. Let's get into this week's episode. Hey everyone, welcome back to another episode of the Dental Download podcast. So this week we have another guest. Her name is Fatemah and she is a dental student. Probably by the time this is going up, she is finishing up dental school, but she's a fourth year dental student in Australia and she is a mother. So we talk a lot about being in dental school as a parent, how that's looked for her, how her journey has been, because she was freshly a brand new mother right when she started dental school. So she's been through a lot of ups and downs and has a lot of great insight to share. I did also want to do a quick little recap of what went on this week for me in dental school, as I usually do. This past week we had 2 exams. On Monday we had an exam in cardiovascular system, and then we had a final today, which is Friday when I'm recording, in our respiratory system. The first exam went really well, and then I'm still waiting for my scores for the exam today, but I feel pretty good about it. I also did some assisting this week that was pretty cool. So I assisted on a maxillary stay plate delivery, and then I also assisted later that day just on a general cleaning. And then the next day I assisted with an implant screw replacement, which was interesting to get to see. I learned a little bit more about implants than what I've learned assisting at an oral surgery office. I wasn't really familiar with what a general dentist and restorative care looks like for an implant. I was mostly familiar with the actual surgery aspect of placing the implant, so it was good to get to see kind of the second part of implant care and the part that a general dentist could be doing if they aren't certified to be doing surgical implants like into the bone. And the rest of this week was really just a lot of studying. I had some club meetings, and I also did a volunteering event yesterday that was at a children's center, specifically children with autism. So we did what was called the Dentist Desensitization Day, and we're going to be doing that pretty much once a month going forward. But basically, we were there in our full PPE and lab coats. We gradually put that on to make them more comfortable and understanding why we're wearing what we're wearing. And then we did some demos. We talked about healthy versus unhealthy foods for your teeth. We did a little flossing demonstration with big size Legos or Mega Blocks and some Play-Doh. And then we also did some practices of showing them some of the instruments in a basics cassette, and we also brought over typodonts, and we mixed some alginate and took impressions of a typodont, and also showed them what some casts look like just so they could get a better feel for some of the things that happen at a dentist office, so hopefully whenever they go to see their dentist, they're a little bit more comfortable. But that's pretty much everything for our recap this week, so let's get into the episode with Fatemah. Want to make a podcast? Spotify's got a platform that lets you make one super easily and then distribute it everywhere and even earn money, all in one place for free. It's called Spotify for Podcasters. Here's how it works. Spotify for Podcasters lets you record and edit podcasts right away from your phone or computer, so no matter what your setup is like, you can start creating today. Then you can distribute your podcast to Spotify, but also everywhere else podcasts are heard. Video podcasts are also available, and you can earn money in a variety of ways, including ads and podcast subscriptions. Did I mention it is totally free, no catch? I've been using Spotify for Podcasters since the very beginning of my show, and now we're nearing our 200th episode, so I can definitely say it's an easy platform, and I've really loved using it. So be sure to download the Spotify for Podcasters app or go to www.spotify.com/podcasters to get started. All right, hi everyone. We do have another guest here today, and I'm going to let them introduce themselves.
Hi everyone. Thank you so much, Haley, for giving me this opportunity. So my name is Fatemah. I currently transitioning into my 4th year of dentistry. I am from Melbourne, Australia, and I study dentistry in a town in Bendigo in the same state as Melbourne, called Victoria. I am a mum, so I've got a 3-year-old son named Ilyas starting kinder this year. And yeah, that's a bit about me.
That's awesome. So I guess for people that don't know, what's the process like of getting into dental school, and how long is your program there?
Yeah, so the degree that I'm studying now is technically an undergraduate degree of dentistry. It's a 5-year course. In Australia, we have sort of two different paths into dentistry. You've got the undergraduate program that for people that are usually fresh out of high school. Um, and then there's also the postgraduate pathway into dentistry. And so I'm a bit of a weird mix because I actually completed my undergraduate degree in biomedical science. So I'm technically, I was applying as a pre-med student essentially. And then things sort of changed for me because during my biomed degree, I sort of started to lose motivation. And I failed a few units in second year, and I was just really doubting myself. It was anatomy and biochem, and they're really, of course, as you know, Haley, they're pretty big subjects that you
Mhm.
need, right, when you're applying for postgrad med. And so, yeah, I just went through a little bit of a rut and had to sort of reassess, reanalyze where I was going, where I was heading. And I think it's similar. The medicine pathway is similar, I think, to the American one, if I'm not mistaken. Correct me if I'm wrong, but you guys have what's called the MCAT exam. Is that right?
Yes.
So yeah. So we also had that for it's called GAMSAT, which is a similar sort of thing where you have to apply with your GPA from your undergrad degree, the GAMSAT, and then interview. So essentially, my GPA wasn't as competitive as I would have liked, and also my score for GAMSAT wasn't too great, and so I wasn't necessarily a strong candidate for the medical degrees, and so yeah, I went through a bit of an identity crisis, and I was like, I don't know what I'm going to do now, and I met my now husband, who is an oral surgeon, and he sort of was my gateway or, sort of what opened my mind into the field of dentistry. It's ironic because I remember telling him, there is no way I'm going to just be staring in someone's mouth for the rest of my life. And I just thought it wasn't the field for me. But spending time in his clinic, looking at the way he interacted with patients, the fact that it was very hands-on, a lot of treatment planning, and a lot of medicine was involved. It sort of started to interest me. And yeah, I found myself looking into how I could get into dentistry because I was always a pre-med, so I had to sort of create that portfolio, if you like, for the dental school. And I found that my university does what's called a transfer pathway. Have you heard of that, Haley, before? Do you guys have anything like that?
Yeah, yeah, definitely.
Yeah, yeah. So I did 1 year of a health science degree, and then at the end of that year, I applied to transfer into first year dentistry, and I got accepted, and here we are today.
That makes a lot
Yeah.
of sense. So, I obviously you thought oral surgery was really intriguing. Are you hoping to do some kind of specialty, or I don't know even how that works in Australia? Do you do your dental degree and then also more schooling if you want to do some specialty?
Yeah, yeah, there is. There are specialty sort of pathways. It's usually, I think, a 3-year course once you've finished. But now I think I went into the dental school not really knowing what I wanted to do post dentistry. But now that I'm in it, I think general dentistry is something that I probably will stay in for a while. I am interested in pediatrics and maybe oral medicine, but for the time being, I feel like it's going to be fruitful for me to just sort of stay as a general dentist for a few years and see how, yeah,
Yeah,
that
yeah.
develops.
Yeah, I understand that. I'm super interested in general dentistry as well. I think there's just so many different types of procedures you get to do. It's very exciting to me.
Yeah, 100%. Totally agree. Yeah.
So, can you talk a little bit about your experience so far in your dental program? What kind of things have you been doing? When did you start seeing patients? How has that been going?
Yeah. So I think we could relate that the first, second year is usually a lot more didactic and preclinic stuff. Third year was meant to be our introduction to start seeing patients, but COVID hit, so it was a bit interesting in that regard. So essentially, we started seeing our patients once or twice a week at Bendigo Hospital. But I think 2 weeks in, everything shut down. So we were in lockdown from March until about November, and everything was online. But now we've transitioned into, we're back to sort of seeing patients. Um, it's not as intense because we're, I guess, balancing both uni and seeing patients. We have like 1 or 2 days a week. But next year, when I start my fourth year and fifth year is practically the placement years where we're out seeing patients most of the time, and we have online classes in the evening. Yeah,
That's pretty cool. So, are you always seeing patients in a hospital setting then, or does that change?
it does. I think it does change. It depends where we're put. So my rotation is going to be, I guess, not a hospital setting, maybe like a clinic, like a larger clinic. Yeah. And uh, like the university organizes our patients' appointments and things like that. So all we sort of have to do is just show up and, yeah, treat our patients. I know I've met some American students that say that they have to arrange their patient appointments. I'm not sure how it is at your university. Yeah, our university takes care of that.
I think that we are given a pool of patients and we are responsible for setting like up their appointments and making sure that like following up, making sure that they remember to show up and everything, but we don't have to at least find our own patients, which
Oh, okay.
some schools they do have to go out and recruit their own patients as well. But I think most programs don't really have much of a problem with that because there is such a need for the lower cost dentistry through the schools.
Awesome. And I think the experience of getting that is it's quite fruitful, isn't it? Yeah, being able
Yeah.
to make those appointments and stuff. Yeah.
Yeah, I think it makes you a little bit more prepared for working in a private practice setting if that's what people end up doing once they graduate.
Yeah.
Kind of on that same topic, do you know? I know you mentioned you'd like to work as a general dentist for a while. When you do graduate your program, do you have any other things you're looking for when it comes to your career or anything else you're planning to work towards?
I'd really love to get involved into organized dentistry and really fill that gap in Australia. We have a big gap in minority dentistry, not much representation. And so I'd love to represent, Black women, Muslim women, because I am a hijab wearing, dentist. So I really want to start, advocating for things like that in that space where I think is, yeah, there's a big need and there's a massive void. So I'd love to get involved into, yeah, organized dentistry and be a voice for people that don't necessarily have one. Yeah.
That's amazing. I really love that. How much diversity is there within your dentistry program? I really would have no idea.
Yeah. So it's interesting. In my cohort, I know um, there is a diversity compared to other universities, which is really nice to see. Our university is also very public health driven, which I absolutely love. Um, and so that's pretty much why I think our course is really shaped in targeting communities that are, yeah, more at need. And so, yeah, our course is very diverse, which is really nice to see. There's actually, I think, 2 or 3 hijabis that are in my course, which is like unheard of, which is awesome.
That's really good then. I'm sure that that will hopefully keep growing towards that direction and more people will feel like they're capable and welcome to be in these programs in healthcare.
Yeah, it's just so exciting to see. Very
Mm-hmm.
exciting. Mm.
Yeah. So, one other thing I did want to talk about with you was about being a mom in dental school and how you are liking that, how that works with your coursework and studying and everything.
Yeah, it's a big question. It's a big part of my life. When I started my journey into dentistry, I was 4 weeks postpartum. So I remember walking into class with like my fresh cesarean wound. And so the first few months, few years were really intense. My uni is about 2 hours from home as well. So having to travel to and from uni and having to pump in bathrooms and trying to navigate those early years especially were really tough. Now that my son's a bit older, I just really value that extra time that I get to have in terms of, I guess what I'm trying to say is I have more of a balance. The first few years I was really immersed into everything was just uni, and making sure that my son was fed, and and you get to lose. I sensed a feeling of like detaching from myself. I got diagnosed with postpartum depression about second year, and so yeah, it was really tough. Sort of trying to navigate through that. But over the years, I've learned that yes, dental school is amazing and it's great, and very grateful for the opportunity, but it's not my entire life. And having to, you need a social life, you need to fit in things that make you happy. And so, yeah, nowadays I find myself, I'm a much more balanced, I guess, student. I have family days, I've got playgroup days, and I've got uni study days. So yeah, it's been a journey, but yeah, it's been really fun to sort of see how I'm developing as a person, as a mum, and as a student, and hopefully as a dentist. Yeah.
That's great. I'm so happy to hear that you've kind of made such strides personally and figured out how to balance everything, because I'm sure it was incredibly stressful earlier on as well.
Oh my gosh, yeah, long time coming. Lots of counseling, lots of help,
Yeah.
lots of support. Yeah, still working on it, but
Yeah, for
yeah,
sure. How
yeah.
common is it for any of your classmates to have children? I feel like in American dental schools, at least, there's maybe like one or two out of like 100 students that have children.
Yeah. Yeah. Similar thing here. I think with my degree, because it's an undergraduate degree, the cohort's much younger. So there's a really
Mm.
less likelihood for you to find any mums. But miraculously, my cohort, at least, one of my closest friends is a mum. And so it's been really great sharing that experience with her. No, yeah, so not common, but yeah, it just worked out so well that yeah, one of my closest classmates is a mum too. So we help each other a lot. We lean on each other a lot. So it's really nice um, to have that. Yeah.
That's great. I'm so happy that you have, luckily, someone that's going through really similar things with you and you guys can be support systems for each other. Do you have
Yeah.
any other tips for anyone that's wanting to start a family while they're in dental school or is already has a child and is going into dental school? Any advice you could give them?
I think the main line of advice is that it's doable. Um, a lot of people go, oh my gosh, it's impossible. How are you doing it? There's always that notion that um, it's just such an ugly experience and you're going to have to, try to balance and juggle things. And I guess that comes with it, but it's so doable. I think if you plan ahead and you are able to have a support system, whether that's family, friends, or childcare, I think it's definitely doable. I know mothers that have multiple children and are doing dentistry. I think it's all about mindset and I guess prioritizing your weeks and your months. Sometimes, you're going to have to dedicate a few weeks to just, school and studying. And then, the next few weeks could be focusing on your parenting and spending time with family. I think it's quite cliche, but having a planner and setting things and dates early, locking them in, and having a really thorough thought out schedule really, really helps, or it helps me, if anything. And I think a lot of reaching out to faculty is really important, letting them know what you're going through. 100%, 9 times out of 10, they're really happy to help you out and adjust. And I've had that experience in my university life. Very grateful for my faculty. They try to accommodate me and my struggles as much as I can. So I guess, yeah, being very vocal about, what's happening at home is important. And also, I'm not sure if you guys have school counselors and things, or bodies that can advocate for you. Also, getting involved with them is really important. Yeah,
Yeah,
it's definitely doable.
Yeah, that's really nice to hear. And even your last two pieces of advice, just being vocal with faculty about what's going on with you and using your counselors, therapists, resources, whatever the school has, I think that applies to every dental student too, because I agree that the faculty at our school are so great. Whatever's happening in a student's personal life, if there's something big going on, they're very willing to make accommodations. So I think people can be very scared for good reason to ever reach out, but I feel like it's always pays off in the end.
Yeah, 100%. I think with us, we work so hard before getting into the degree. Everything's got to be perfect. We've got to be perfect. Our grades have got to be perfect. And then, yeah, we get into dentistry and it's like, yeah, we forget that it's okay to just sort of breathe and relax. We're here taking that experience. It's inevitable that you're not going to do things really well. It's a learning process. And yeah, and talking about it with your friends at least is really important. And not, we're all going through the same thing, right? And so, yeah, I'm a big advocate for talking things out and
Hmm.
being vocal. Yeah.
Yeah, and it sounds like the dental school struggles are pretty similar, even all the way around the world. So definitely
Yeah.
that there's always someone out there that's going through the same thing as you.
Yeah. 100%.
So we covered a lot already today, but do you have any closing thoughts for the listeners? Anything you want to leave them with?
Have faith in your path. Have faith in the journey that you're going through to, whether it's dentistry or anything else in life. I mean, sometimes you feel like it's really tough, and you can, giving up is always the easy route. And so just persevering through whatever it is that you want to achieve in life, and immerse yourself, but be present. Something that I struggle with is always going, okay, what's the next step? What am I going to do? What's happening? And planning ahead is great, but sometimes, yeah, just enjoy those steps and enjoy that journey of yours. And nothing's impossible if you put your mind to it. I know this is all cliche, but it's true and it works.
Yeah.
Yeah.
Yeah, I totally
So
agree. I guess that's everything for today. What's the best way for people to get in touch with you if they have any more questions? Should they reach out to you on Instagram?
yeah, I have a blog called Fatemah Smiles. Yeah, DM me whenever. I'm always available and happy to chat. Yeah, so Instagram's probably the best way to get in contact with me. Yeah, I'm also on LinkedIn as Fatemah Osman, so you can always find me there as well.
Awesome.
Yeah.
Well, thank you so much for your time today.
Thank you so much, Haley. It's been such a pleasure.
All right, that's the end of this week's episode. I hope you enjoyed. And next Monday, we will be joined with another guest, Dr. Portia. She is an oral and maxillofacial surgeon and also a proud woman in surgery, a proud Black woman in surgery. So we talk a lot about the challenges that minorities face in dentistry, in medicine, and healthcare, her journey getting into oral surgery, her journey with the military, and kind of where she's at now. She is balancing work, a family, and also some kind of side businesses. She has a scrub line. So there's a lot to unpack with her, and I'm excited to share that episode with you all next week.